Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. More than half of medical students in the United States are female, which helps increase the number of female physicians practicing medicine. But the medical specialty where women remain significantly underrepresented is neurosurgery. Today, I'll be talking about the reasons for that and the efforts Upstate has made to improve that with Dr. Larry Chin. He's a neurosurgeon and dean of the Norton College of Medicine at Upstate. Welcome back to The Informed Patient, Dr. Chin.
Well, thank you for having me, Amber.
Now, the neurosurgery program at Upstate comes out at the top of a survey of leading medical schools for female neurosurgeons in a recent paper in the Journal of Neurosurgery. So I wanted to ask you about that. Can you describe what the authors of this paper looked at?
Sure. So the paper that we're talking about was published in the Journal of Neurosurgery, and the title is Leading Medical Schools for Female Neurosurgery Graduates. And it comes out of the University of Illinois at Chicago. And what the authors did was they identified from a national physician database all of the practicing doctors who list neurosurgery as their specialty. And then they looked at the education, the medical school education. So it's not actually looking at the residency training program, but the medical school from which they graduated. And then they looked at the schools and the total number of neurosurgeons and how many were male and how many were female. And then they also looked at the proportion of the total number of neurosurgeons that they graduated and what percentage were women or men. And it was in this last category, the proportion of female neurosurgeons, where SUNY Upstate did quite well. And specifically, what we're looking at is the schools that had the highest proportion of female neurosurgery graduates. And there were two at the top, and that was at 25%. The two schools were University of California at San Diego, and the other school is State University of New York, Upstate Medical University. And I'm quite proud of that.
Well, let's talk about what a neurosurgery residency includes, because this happens after medical school, right?
That's right. You graduate from medical school, and then the next step to becoming a practicing neurosurgeon is to do a residency. And residencies in the past have varied in number of years, but for the last 30, 40 years, it has been either 6 or 7 years. And in the last 10 years or so, it's become standardized where it takes 7 years of training after graduation from medical school. So we call it postgraduate training or graduate medical education. And that's a minimum of 7 years, although many neurosurgery residents, after they graduate from residency, will do an additional fellowship that may last 1 to even up to 3 years. So you could conceivably be in training for 9 or 10 years before you actually become a practicing neurosurgeon. And just for context, in the study, I should add that they identified a total of almost 3,500 neurosurgeons in this national physician database, and 91% were male and 9% were female.
So that's 3,500 practicing neurosurgeons in the United States. Is that enough, or do you think that we need more neurosurgeons?
Well, like some specialties, some super specialized areas of medicine, in addition to probably not enough specialists, there's also geographic inequality. So as you might expect, large urban areas certainly have enough, or maybe in some cases, too many neurosurgeons. And then you could go to vast areas of the country, and I would consider central New York one of those areas where there are very few neurosurgeons relative to the geographic area and also available for what amounts to a largely rural population. So the absolute number of neurosurgeons is probably not so far off, but the distribution is not even. Now, neurosurgeons are very specialized. If you look at other fields, for instance, family medicine or pediatrics, there is just an absolute shortage. So in general, there is a shortage of doctors available, but the greatest areas are the primary care specialties.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Larry Chin. He's Dean of the Norton College of Medicine at Upstate and a professor of neurosurgery. In the paper from the Journal of Neurosurgery, the raw numbers of female neurosurgeons are bigger from the bigger schools like Yale and Stanford. But if you look at the proportion of female to male neurosurgery graduates, like you said, Upstate and the University of California at San Diego come out at like 25%. So at Upstate, 4 of the 16 practicing neurosurgeons were women. And I believe you were the chair of the department at the time period they were looking at. What was done at Upstate to attract women to neurosurgery?
Well, I can't take all of the credit, that is for sure. I came to Upstate in 2011 and I was chair of neurosurgery until 2019. And the study actually stopped collecting data. I think the last year was 2014. And there are some reasons, the main one being that it takes time to train. So if you started training in 2014, you might not be in practice yet. So they didn't collect data after 2014 so that wasn't going to affect the numbers. But yeah, I think that it's fantastic that Upstate has this legacy of training, I guess you would say a disproportionate share of women in neurosurgery. What did we do different, or what has been done differently in the past? I think that Upstate really has a tradition of being champions of equality. Some of the listeners may know that Upstate graduated the first woman who was granted an MD degree in the US, and that, of course, was Elizabeth Blackwell, and that was in 1849. We have a very long tradition of really paying attention to that. Sarah Logan Fraser was one of the first Black women educated and graduated as an MD in the US. So there's this great history. We've had more recent role models and mentors. Dr. Pat Newman, who was head of the American College of Surgeons and one of the founders of Association of Women Surgeons, I think has been a great role model for women in surgery. And she continues to be affiliated with the medical school. And I think is just a wonderful person for really all students to look up to. And I think that Upstate has been a place where paying attention to things like equality and having women have the access and the mentoring and the encouragement to go into specialties where traditionally they've been underrepresented. It's just something that we pay attention to.
Is it true that more women than men apply to and are accepted into medical school these days?
Oh, absolutely. If you look at our recent classes, anywhere from 55, 56%, I think we've had a class as high as in the low 60% are women. And that is a trend that exists across the country. And so more women apply than men, and more women get accepted than men. And so it's really changed, I think, how a lot of people perceive what a doctor is and what a doctor looks like. For me, there's nothing but good that comes from that.
So what do you think it is about the specialty of neurosurgery that in general tends to attract more men than women?
That is something that people have thought about and even written about for the last 10, 15 years, we've been trying to understand that. And it's not just neurosurgery. So in fact, the specialty that has the lowest percentage of women is orthopedic surgery. If you look nationally, women in terms of practicing orthopedic surgeons, probably a little over 5%. For neurosurgeons, you'll see numbers that range from 7 to 9%, depending on the study that you look at. So orthopedic surgery, neurosurgery, another area is interventional radiology, also very low numbers of women, interventional cardiology, and many of the cardiac related fields traditionally do not have a lot of women. And so what are the reasons? There are many. First of all, there is, I would say, this long-standing perception for certain fields. Maybe it's a stereotype that has been wrongly passed down, but that the field is somehow more optimally suited for men. And I think that is a myth that has been long dispelled, but somehow some things, the perceptions don't change. And that's why we see specialties like orthopedic surgery and neurosurgery not have enough women in the field. But then there are more tangible reasons. I think that if you survey medical students, there are still people that would look at, well, what's the flexibility in this specialty with regards to parental leave or the ability to have a family? And that is something that weighs more on the minds of some women that are in medicine. And that has been cited as a reason. I think that we have to be honest and still say that women still, even in this day and age, face, if not overt, but subtle forms of harassment, especially in certain surgical fields. And I think that that is something that creates a negative environment for women. There are issues related to salary inequality and other minor things that can influence how people feel about, do I feel welcome in this specialty group? And then traditionally, if there aren't as many women in a field and there aren't as many role models and mentors, that will influence the numbers of students that would be interested and feel like, well, I can see myself being a neurosurgeon or an orthopedic surgeon.
So there must be specialties that have more women in them.
Oh, absolutely. Certainly the one that has the most women is OBGYN, where the vast majority, I've seen one study that well over 80% of the specialists in that field are women. But certainly the pediatric specialties oftentimes are very much heavily weighted to more women in those fields.
So let me ask you, is the profession of medicine striving to mirror the diversity of the population? Are you trying to have an equal number of women as men, neurosurgeons and pediatricians, or not?
Well, I think in general, yes, we would love to see the proportions of medical students in general mirror the population, but I don't think that is everything. For instance, if you look at the numbers of Black and Brown physicians, if you just mirrored the population, it would still take a long time for the practicing pool to catch up with what the population looks like. Same thing with women. If we continue our trend, which is if you look at the number of residents, so the people in training who are women, it's much higher than the number that are in practice. So if, let's say the number is there 9% practicing neurosurgeons are women, the number of neurosurgery residents who are in training that are women is much higher. It's almost 20%. But that gap is still going to take a long time to close if you want to have basically 50% of each, men and women, in neurosurgery. So it would take still a long time to catch up. So I think that while, yes, we want to mirror the population, I think we also have to be mindful of the fact that there were many, many years of inequality, not only in neurosurgery, but other fields and inequalities in terms of women and men, but also of other groups.
As dean, how do you assess whether someone who applies to attend medical school will make a good doctor?
We have a whole team that is specialized in doing that. As dean of the school, I actually do not directly get involved with the admissions process. We have a dean of admissions, Dean Ruiz, who does an outstanding job. And there's a committee dedicated to reviewing students and their applications. And they do a fantastic job. I think our medical school classes are not only diverse, but the students themselves are outstanding and they're contributors to their community. And so what I tell our admissions committee is I want the best students because I think that our patients in our community deserve the best and the brightest taking care of them. But I want our students to be diverse because they can learn from each other and the diversity makes the education better and it helps everybody grow and it improves our healthcare. And so we really look at all factors. And I think that from that diversity, that's what helps the education to turn really these outstanding students into outstanding doctors.
As a neurosurgeon yourself, is the field of neurosurgery today something that you would recommend a new doctor go into?
Oh, absolutely. I think that it is not only extremely interesting and challenging, and if the technical aspects, and especially operating, appeal to a student, then for me, I can't think of a more rewarding field. Now, I think that every single field in medicine has all of those attributes, and there's the right student for each of those fields. And so I don't think that being a neurosurgeon is any more special than any other field. But for me personally, I love what I do, and the people that I see go into the specialty, they love it as well.
Let me ask you though, the 7-year residency, why is it so long? Are they doing the same things over and over, or are they doing that many different things that it takes that long to fit it all in?
Yeah, that's a great question. And actually, one of the things that is thought about in terms of, well, do you really need 7 years to be a neurosurgeon? And with the shortages of various specialties, does it make sense to try to train people quicker and get them into practice sooner? I think that if you look at the field and you look at the very large variety of things that neurosurgeons do, I think the 7 years is justified because a neurosurgeon isn't just operating on the brain. You're also operating on the spine and also on everywhere the nerves go in your body. So it is a very large number of different kinds of operations, ranging from techniques where you're putting screws into the bones of the spine to doing delicate surgery on the brain under an operating microscope. And so just the tremendous variety of different types of surgery. And then you touch on it. There's a lot of practice involved. And I think that we want to make sure that we're training the best neurosurgeons and that when people go out, they're not only competent, but they're safe. And I think that that takes time. So while 7 years or 8 or 9 seem like a lot, I think that it takes that long to properly train someone.
Dr. Chin, thank you so much for taking time to tell us about this.
Well, it's wonderful to be here and thank you for inviting me.
My guest has been Dr. Larry Chin, the Dean of Upstate's Norton College of Medicine and a professor of neurosurgery. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.